answer to it. There is so much controversy connection between CCSVI and MS, and they seem to be connected in how we are treated them as people. I was wondering, why is it that we need to be, in a sense, prevented being treated for CCSVI? Why CCSVI is it not considered as a separate condition? I mean, I know when my MS started, it was induced by an accident. Because before, my symptoms were very little. And after the accident, I started having more severe symptoms. So basically, I had CCSVI, not necessarily MS. And nobody really paid attention to the blockages in my veins. They have done MRI to find out if I had lesions with that, which I did. And that was 4 or 5 years after the accident, even though I have complained about my neck so much.
Well, you never find something if you're not thinking about it. It's tragic, but it's true. And, you know, so I'm going to go the other piece and talk about the elephant in the room that we haven't talked about much yet. We're going to talk about that elephant a lot in 10 days. And Dr. Kirsty Duncan is here from Ottawa, okay, because she's here in Vancouver, and she's very passionate about this. We have to relook at chronic illness in Canada. Specifically, we have to relook at how we think about brain illnesses. Specifically, in this case, multiple sclerosis. It's a tragic entity currently, because currently people with a diagnosis of multiple sclerosis are treated differently than anybody else. And that is lousy, lousy medicine.
Thank you. Yes.
I'm really angry.
I had my right jugular balloon, but when they had the camera up there, they told me that in my left jugular, when I breathe, the contraction of my muscle is closes the vein, then it opens up again when I breathe out. I just wondered if either of you have heard of that, if there's anything that you could recommend.
That's true. It's quite often seen in the mid portion of the jugular vein due to compression by the sternocleidomastoid muscle, which is the one that comes out on an angle there. What we've found and hypothesized as well, that many of those cases where we do see what may look like a stenosis in the mid portion of the jugular vein, what may be an unusual susceptibility to pressure changes in that jugular vein are really due to the valve. The valve downstream in the flow affects the hemodynamics upstream in your jugular vein. And once that valve is fixed, any abnormality or apparent abnormality in the jugular vein corrects itself. So what I would say to you is, if someone says, it looks like you have a stenosis in your jugular vein, and tell them, please look at my valve.
That's probably a piece I should have stated at the beginning. Both of our jugular valves, both of our jugular veins come down, and they have a valve right as they go into the next blood vessel. It's always at the bottom of the jugular vein, okay? And that valve is probably an issue for me on both sides, okay? But that valve is where we need to be thinking about treatment and the issue. And that's been brought forward to me even this evening. And I don't think that the entire planet is used to that set of concepts. But that's where the valves are in the jugular, right at the base, just as they flow into the other. So they affect everything above that.
I'd really like to reemphasize this to all of you who are going to get treatment, is to be thinking about this and asking very pointed questions to your treating physician about this, because a lot of the re-interventions we've had performed are for people who've had stents placed in that mid-jugular location where there's really no problem. Should never have a stent put there in the first place. An angioplasty of that valve is often sufficient to correct what looks like a problem at that location.
Why has
and he's currently on Tisagri, which we're trying to get off of. So we're hoping that after the treatment, he can come off it. Now, as part of any treatment plan, is any advice given about how to do that? Because we're not getting any cooperation from his doctors.
Unfortunately, the answer I'd give you is absolutely not. The neurologists dislike us enough the way it is. The last thing we want to be doing is interfering with the medicines. What I do tell patients, however, is that your right as a patient is you don't have to listen to your doctor, right? You have rights. It's like everything else in life. You want to collect data and make the decision that's best for you. And part of that decision process is going to, if you decide to get the treatment, you evaluate your symptoms, and you go in and you ask your neurologist about maybe changing the medication you recommend on. We're not going to tell you that you should or you can or anything in that regard, other than the fact that if your symptoms change, you may want to discuss your medicines with your neurologist.
That's a great question, because I know when Benita and I went to Mexico, we asked our little doctor, Dr. Mogel, who is about this big with little hands, but we thought, little hands, that's good. So we asked him what he thought about going for surgery. Sorry, I couldn't help myself. But we asked him the same question, what do you recommend us staying on our meds or off our meds? Like Benita said, she never went on meds, lucky for her. I've been on Reba for 9 years. And I made the decision before I went to Cabo to go off it cold turkey. And I've been off it for over 3.5, almost 4 months, and I'm absolutely, totally awesome, fine. Except for a few breakouts on the face, which I think is the toxins coming out. So, I think there was a question over there.
Yeah. I'm very thankful that I can be here tonight, and I would like to ask who from all of us had already done this CCSVI treatment done? You. I would like shortly to share my experience. I had it done on the 1st of July this year. South of San Diego. It is in Rosarito, San Luis, just over the border of Mexico. So the treatment itself was done in Tijuana, in a very new hospital, but San Luis was doing the Doppler ultrasound and all the other things which were necessary in this connection. And I was very well treated, and from the very beginning I had to pay 2 follow-up treatments. So I was already once there at the end of August, 2 months later, and I have the possibility to go again in January coming year. And this is already thought to be part of the whole treatment. And I'm thankful for that.
Final questions before we end? David's got one over here.
Dr. Good. Thank you for coming out. I had 2 valves that were ballooned. And I'm still trying to get my head around the ballooning of the valves. I had stenosis, 70% stenosis in both valves. When you balloon the valves, what does that do? Is it opening up the valve? My understanding of the valve is it open, close, open, close.
Yeah, the valve is essentially a fibrous ring, and with 2 flaps, and those flaps allow blood to go in one direction. What's key is that fibrous ring, we believe, is too small in people with altered hemodynamics in their veins. So when we angioplasty that fibrous valve, what we're really trying to do is disrupt it, to tear it, to allow that fiber to open up to a larger level, because that's really the flow impediment in the vein. Of course, we find other stenoses elsewhere in the jugular veins that are due to a variety of other factors, but that valve itself it's a fibrous ring that just essentially needs to be broken.
Does it not close, open, close?
If we open up the fibrous ring, there's still going to be some hemodynamics from those flaps, but the flaps are sort of another subject altogether. Really, we're talking about restriction of flow because the ring is too small. So she described having a stent in her jugular vein, and the possibility that it could incite or cause a restenosis. And how do you know you're having a restenosis? What symptoms? It's very simple. In general, if you have recurrence of your MS symptoms, there's almost a 100% chance that you're restenosing.
So all the symptoms, or they come slowly one after
I think it's
the
very, very individual. It's different from patient to patient, but I would say any recurrence of your symptoms, you should be thinking about the possibility of a restenosis.
So if I have MRI, will that show the stenosis?
Yes, if you have there's many different types of MRIs, but a properly performed MRI can show a restenosis. And really, everyone here is talking about follow-up. There's many different shades of gray for follow-up, but I would say the most important part of follow-up is, unfortunately, if you have recurrence of your symptoms, chances are that vein has occluded or restenosed in some fashion. That's really the main indicator for a follow-up. It's pretty simple.
I want to tell everybody here, I have an issue with getting MRI in Vancouver at any clinic. From now on, there is no problem. Whoever wants to have MRI needs to go to Vancouver General or UBC, and there's a form to sign that you release, their responsibility of the outcome if there anything happens, but you are entitled to have MRI in 10 days. You can start following.
Expert Jenna. So we're going to end the session now because I think we can probably go on for hours and hours and hours. This is such an interesting topic for most of us. So I just had a few things that I wanted to close off with, and I had a few thank yous. I wanted to thank Kate's daughter, Rose, who made the fabulous buttons that were at the front. So thank you, Rose. I wanted to say a big thank you to my friend Carol Bucher, who has been typing her fingers off in the back corner, doing real-time reporting for one of our guests. So thank you, Carol. And I'd like to thank all the volunteers who helped here tonight. This couldn't have been possible without all your help. And look at the turnout, how fantastic, right? Thank you to all of you, and I wish you all the best, and I hope for all the best, and we're going to make this happen in our country. Just the last two things. Dr. Hewitt is going to stick around if you wanted to speak to him and about the Pacific Interventionalist Clinic. And as well, if you want to get tickets to